Hi, my name is David Grabowski. I'm a professor of healthcare policy at Harvard Medical School and a Nexus fellow. I've been involved in studying aging and long-term care for over 20 years. My research has examined how long-term care and post-acute care are financed, organized, and delivered for older adults. I'm particularly interested in how we can reform these care systems to improve access and outcomes for older adults and their caregivers. My primary focus as a professor is conducting research to improve long-term care and post-acute care for older adults. Towards this end, I have published over 200 peer-reviewed papers on these issues. As a researcher, I also try to engage policymakers to advocate for better policy based on my research. I regularly testify to Congress and have served on several CMS technical expert panels. Most recently, I have also served as a member of the Medicare Payment Advisory Commission, or MedPAC, which advises the U.S. Congress on issues related to Medicare policy. I would say the biggest challenge in aging is twofold. First, we don't spend enough money to support the care of older adults. Many of our caregivers are underpaid and undervalued. We need to continue to ensure that sufficient public dollars flow to direct caregivers. Second, we spend money on the wrong things in aging. We need to transform our spending away from big institutional models of care and towards more person-centered models. I am thinking about small home nursing home models and home and community-based care models. Institutional models that didn't value individuals or their caregivers, we need to move away from those models and towards these more person-centered models of care. I think people have always wanted care in the most person-centered, home-like model possible. Unfortunately, we haven't always offered a lot of those options to individuals in the marketplace. And so my hope is that as baby boomers age and demand more out of our senior living and aging industry, that those models will emerge. And we need to continue to advocate for what individuals want and what they're willing to pay for, and then what public payers are willing to commit to and support as well. But there's a tremendous need for transformation, both in the models that are out there, where individuals are receiving services. Far too many individuals are still receiving care in a more institutional setting. I think there's a real opportunity to both transform nursing homes, but also home and community-based care models in the coming years. So if I could wave a magic wand and improve one thing about aging in America, it would be to change our societal attitudes about older adults. We are all collectively in denial about the state of our care system for older adults in this country. We all believe that things will be different for our own generation when we get old. Things won't be different unless we invest in meaningful change. At the root of the problem is the belief that many Americans hold that long-term care and post-acute care are family issues. They're not. These are massive policy issues. Currently, we rely heavily on families in the U.S. to finance and provide care. There are countries elsewhere in the world that have invested in models that encourage person-centered care for older adults. So if I could wave that magic wand, I believe we would have a system that was better funded, more equitable, more person-centered, and better performing. Given I don't have that magic wand, unfortunately, I'll continue to conduct research and engage with policymakers to improve our current system. I think we're seeing a slow transformation in aging right now. One is towards more home and community-based care models. So I think the recent policy steps we've seen towards increased investment in community-based care is incredibly important. And then I think the other slow change is this realization of around the importance of the workforce. And we've undervalued and underpaid our workers for so long. And for the first time, we're seeing different states, and to a lesser extent, the federal government, recognize that it's all about the staff, it's all about the caregivers, and any system is only as good as our caregivers. And so what I'm particularly excited about is just this increased realization that we need to pay workers a living wage and really create better working conditions and a better environment for them. And that's the only way forward towards improving the system. What makes me incredibly excited about Nexus is just one, the community of other fellows, the opportunity to work alongside these leaders and debate and think about the problems facing aging is incredibly exciting. And then two, there couldn't be a better time right now to engage with these other fellows around transforming our system. I think these issues have been around for a long time, but we as a society have largely ignored them. With the pandemic, these issues around aging have now bubbled up to the surface, and there's a lot more attention. So this is the perfect time and the perfect group to really engage on these issues.